Welcome back friends, myself Dr. Maddineni Srinivas. So this is today's our MCQ. 36-year-old female smoker reports having rest pain and lower extremity digital ulcers for 3 months. She also reports a 2-year history of claudication. Which one of the following is the best means of preventing amputation? So with all these clues, if you have diagnosed this as a case of thromboangiitis obliterans, which is also called as Buerger's disease, then your diagnosis is right. And yes, most of the students marked it right. It is the cessation of the smoking that is going to prevent the amputation which these patients have to undergo. So few points about this thromboangiitis obliterans. It is associated almost exclusively with smoking, that is tobacco usage, and not only just the normal cigar smoking, even the cannabis smoking can also induce this. And you can see the name of the disease is Buerger's disease. And this basically affects small and medium sized arteries, and also veins can get affected. And most importantly, hands and feet are the ones which will be involved where ischemic changes can be best observed. And few statistics, 75% of the individuals are men who are affected, but yes, even women can also get affected. And the most important treatment, or we can say prophylaxis, which we should advise the patients to prevent the forthcoming amputation, is cessation of the smoking. Cessation of the smoking is the most important next best step which can be done to prevent the amputation. Very important point. And yes, ischemic changes can be seen. And usually in vasculitis, there will be certain markers which will be positive, like for example, C-reactive protein can be seen in these patients, and ESR can be elevated, ANA or ANCA can be seen. But all these markers are going to be negative in these patients of Buerger's disease. And yes, this we have already seen, and there is very little evidence for the treatment of Buerger's disease with systemic steroids or anticonvulsants, which were the other options if you have seen in this question. So, no, calcium channel blockers, warfarin, anticoagulation, pentoxyphylline, they are not going to prevent the amputation, but it is cessation of the smoking, which is helpful. Please do hit that like button so that I can make more of these questions and videos on my YouTube channel on a daily basis. The subjects Sarvam Sri Krishna Sarve Jana Sukhino Bhavantu.